Good morning, everyone. Today is Saturday, June 20th, 2026. My name is Neil Nandi. I'll be your moderator and host today for SAIA's continuing and enduring live stream webinar series. Today, we'll be talking about well-being, wholeness, integrative care, and how it's integral to inflammatory bowel disease. We have a whole host of great guests and patient advocates for the conversation today. And we're going to let more people trickle in, but I'm going to go ahead and get started so we can really get to the heart of the discussion. Again, today we're talking about whole person-centered care in chronic GI illnesses. And this is a really critical conversation that's important for patients, for caregivers, for all sorts of providers to better understand how to misconvey or identify myths and misconceptions about integrative care. What does the evidence say, and how we can integrate it to really provide our patients holistic care. Again, my name is Neil Nandi. I'm the chairman of the board of SAIA and co-founder. I'm professor of medicine and the clinical director of the Penn IBD program. And I'm joined by several great guests. I'm going to go ahead and start with the very first, which is Dr. Chiti Parikh, who's an integrative medicine specialist at Weill Cornell. Chiti, can you go and introduce yourself a little bit?
Thank you so much for having me. This is really exciting. I've been practicing integrative medicine for over 10 years now. I train at Cornell, but my goal has always been to bring the best of both worlds, Western medicine, Eastern medicine, to really help the person in front of me. So I'm very happy to be here and share my experience and learn from all of you.
Thank you, Chiti. We're really happy to have you here. Next is Dr. Joy Liu. Dr. Liu is assistant professor at Northwestern and specializes in functional disease and marries it with IBD and a host of chronic GI health conditions. Joy, can you tell me a little bit about yourself?
Yeah, thanks also for having me. So I tend to see a lot of, what we call functional bowel disorders, motility disorders. So that can include IBS, refractory constipation, fecal incontinence, also gastroparesis. And in the course of seeing those kinds of conditions, I'm very lucky to be at a place where we have the resources to practice an integrated model of care. And sometimes that includes integrative medicine. And we do get a lot of questions about how lifestyle, diet, and supplements factor into GI health. So excited to participate in this talk.
Thank you so much for making the time, Joy. Next is Tina Aswani-Omprakash. You know her as Own Your Crohn's and also the CEO and co-founder of SAIA. Tina, welcome to the show. You need no introduction, but please, for our audience who might be new to you, please give yourself a brief introduction.
Absolutely. Thank you so much, Dr. Nandi, and thank you, Dr. Parikh, Dr. Joy, as well as Gaurav for being on this talk. My name is Tina Aswani-Omprakash. I'm a Crohn's disease patient advocate, also living with an ostomy. I have multiple digestive diseases, gastroparesis, IBS-C, as well as on and off SIBO that I've been managing for years. And I'm thrilled to be a part of this talk and to have such wonderful HCPs and a wonderful patient advocate from India on the talk as well.
Thank you, Tina. Thanks for making the time as well. And then last but surely not least, we have Dr. Gaurav Sengupta, who's a doctor in his own right, but businessman, entrepreneur, and staunch IBD advocate who's been a guest of the program for over the last 5 years, if not longer. Gaurav, tell us a little bit about yourself. Gaurav is also my Bengali brother from Kolkata, so really happy to have him on.
Thank you so much, Dr. Nandi, and very good evening from India to all the esteemed clinicians, as well as fellow patient advocate Tina Aswani-Omprakash. I'm Gaurav. I'm from Kolkata, India. I was diagnosed with IBD in the year 2015. I've also been diagnosed post-2020 with IBS, as well as SIBO on and off, just like Tina mentioned. Very happy to be a part of this important conversation.
Thank you, Gaurav. Again, good evening to you and making the time on a Saturday evening over there for us. So let's get right into it. We have a lot to discuss. And first, let's be on the same level playing field. What is integrative medicine? What is integrative health? And I'm going to direct this to Dr. Parikh. This is her primary specialty. Dr. Parikh, can you enlighten our viewers? What is integrative health? What does that mean?
So integrative medicine is an evidence-informed approach to whole person care, which is really combining the best of conventional medicine with complementary therapies in a way that is safe and effective. I don't like the word alternative medicine because that implies that you're doing something instead of something, right? But I like to think of integrative as all-encompassing, inviting and adding things that are synergistic. And ultimately, what we're trying to answer is a broader question. What else can I do as a patient, or what else can I do for my patients when it comes to helping them feel and function even better? So think about integrative medicine as that those extra tools in your toolkit that you have to help you feel, function better, address the symptoms that might not be completely controlled currently. And the way I do that as an integrative medicine practitioner is really focusing on the 4 pillars of integrative medicine. And the number one is sleep. Then we talk about nutrition, physical activity, and then stress/symptom management. And we might use different tools in our toolkit, such as things like acupuncture, meditation, yoga, Reiki, certain supplements, herbs, right? So we have access to these evidence-informed approaches that we can bring in to answer the questions like, what else can we do to help you feel and function better?
That was a terrific answer. That was great. That was very holistic, and you kind of outlined 4 pillars of where you might focus counseling. So tell me, how does one go ahead about finding an integrative specialist? How do you vet them? What should a patient or a physician like myself look for in referring to an appropriate integrative specialist?
So there is a lot out there, and I think it does take a lot of effort, unfortunately, to find someone who is genuine in this field, because as you can imagine, there's a lot of money to be made in this field. So we do see a lot of established practitioners, but we also see a lot of people trying to turn a quick buck. So we have to do the due diligence to find the right people. So first and foremost, I always start by looking for someone with medical training or licensure. So if you're looking to work with someone, so go with a dietitian that has a medical training and licensure. Think about an acupuncturist who also has to go through extensive training, get a license to practice. So, or a clinical psychologist. To start with people who have that training and licensure, because that's, again, they're going to help you with those 4 pillars. The second thing you need to focus on is whether these practitioners are willing and open to communicate with your doctors. So I often think about, inviting people into a collaborative care model. So make sure you're picking providers who are open to that collaboration and who are using evidence in a way that is making your treatment safe and effective. Some of the red flags to look out for is that anyone who overpromises and tells you something, tells you to do something out of fear and says, oh, you cannot do that. That's going to ruin don't take biologics. That's going to ruin your immune system. Instead, take the supplement, right? And the last thing I'll say is you want to find a provider that is willing to work with you. There's no cookie cutter approach. There's willing to listen to you and also learn with you and learn from you. I have learned tremendously from my patients, and I often lead with humility. So that is something you really want to look for in a practitioner who doesn't always say, I know everything, but they're willing to learn with you, for you, and then create a program that really works for you.
No, I love that. I mean, I think you're right. First off, makes sense, right? Everyone, if they're going to practice to a certain part of integrative health, complementary medicine, they should have some type of licensure, some type of training that you can check, right? Board licensure exists for dietitians, acupuncturists, et cetera. Really important. I want to ask the patients, what's your experience in trying to find the right specialist? I mean, that sometimes your doctor may not be the one who's made you think about seeing such a specialist. What's your experience? Has it been easy, hard? How did you find one?
I'm happy to start, and then Gaurav, please go ahead. So for me, it was really challenging, Dr. Nandi's team. I think there was a lot of family pressure for me to try Ayurveda, naturopathy, homeopathy, traditional Chinese medicine, and then to retry it if it didn't work. And I went to a number of different specialists, like Dr. Parikh mentioned, out hundreds, if not thousands of dollars of life savings trying to get better, all just to avoid biologics or all just to avoid medication to relieve chronic constipation. And yes, sometimes medication is needed to relieve chronic constipation. It is a thing. And I know it's very stigmatized to use medication, especially for some of these gut ailments that we think why can't we just use diet? Why can't we just use something quote unquote natural to get rid of it from the root cause, often is what I hear. And I would say I went through many iterations of trained, maybe untrained, so-called specialists without understanding who I should go to. And I'm really grateful for HCPs like Dr. Parikh, even like Dr. Joy, who take the time out to really understand, the whole person well-being of patients that come to see them. Because eventually I did, and it took a long time to find an HCP in New York City who understood both sides and could really provide me the kind of integrative care that I needed. Now I have all my supplements either recommended or checked if I come across supplements by this physician. And I also check with my hepatologist or my GI because I have autoimmune hepatitis as well, in addition to all the GI conditions, just to make sure this is not going to tax my liver or really, ruin my liver. So I check everything with my providers. And that's also hard to do, to admit to your doctor. And I hope we can get to that as well.
Yeah, I think that's a really important point. We're going to talk about potential side effects of supplements, possibly. Gaurav, what's your experience been like with finding these providers?
Thank you for the question, Dr. Nandi. India has a lot of options for these alternate therapies and medications, so to speak. Especially, I think there are a dime a dozen homeopaths, or homeopathy is a very, very popular option. So is Ayurveda, because India is the land of Ayurveda. When it comes to dietitians or functional medicine specialists, there are fewer options, and dietitians are mostly those. I don't think too many dietitians here are trained in GI conditions. There are more dietitians that, cater to weight loss and so on and so forth, and other sort of, morbid, conditions. But what I have experienced is a mixed bag. When it comes to homeopathy, it's kind of helped me sometimes with my IBS symptoms. But when it comes to Ayurveda, I've had not so nice experiences where there have been other side effects that have sort of affected my system in the long run. And I've had it in very short bouts, and I've had to let go of it. When it comes to dietitians and functional medicine doctors, I realized that with my condition, it's very specific, and it's a trial and error for me myself. There hasn't been a lot of luck in people actually understanding what the IBD diet of me, particularly in person, should be. They've given me very, streamlined, generic kind of diets, which hasn't really worked for me. So yeah, it's been maybe with homeopathy, I've had a little bit of positive outcome, but with other such alternate therapies, it's not really been very, very positive for me in the long run.
Yeah, I'm really sorry to hear that, Gaurav. And the trial and error. We don't want error. We want trial and see, and hopefully no harm is done. Right, kind of alluding to why Tina was being cautious and making sure her hepatologists and other specialists were involved. Hey, I'm taking something. Can you monitor with me? Just want to clear it by you. Those are always good things to do. I want to ask Dr. Lou and Parikh, when you're working with an integrative specialist and you're talking to a patient, right? Are there any, green flags, red flags that you might be thinking of, that you might be educating the patient on thinking about when they're selecting their interdisciplinary team? Dr. Lou, any initial thoughts on that?
So from my standpoint, what I'm able to do for patients is prescribe medications, advise on the use of over-the-counter medications, and then refer to, other clinicians like the psychologists and dietitians who are part of our team. We do have patients who come in seeing the integrative medicine specialists who are at our institution at Northwestern, or more often from outside of our institution where we don't have access to the notes and the records like from those other providers. And so I rely on the patients to provide me any records that they think are relevant. I do have patients who bring me results of testing from their other providers, which I review with patients. And when I look at those results, there are certain results that overlap. So GI relevant results like a fecal elastase level or a fecal calprotectin level that might be part of somebody's functional medicine testing. I can look at that result and discuss it with the patient. When it comes to other studies like the microbiome studies, where there are hundreds of bacteria that are being analyzed for, I'm just very clear with the patient that I see these results, but I am not trained in how to interpret those. And I sort of defer to their functional or integrative practitioner who ordered the test. People will, sometimes ask about supplements that their other providers have recommended. And in some cases, I am able to comment on, some supplements that we also recommend for symptoms, whether it's things like ginger or turmeric or other sort of more common kinds of supplements. Maybe Dr. Parikh can comment on this more, but sometimes I see patients on supplements that have like very long names or are very specific, or like tinctures or dilutions of things. And I just tell the patient that I'm not really able to comment on those. I don't know if there would be interactions with other medications that I prescribe.
Mm-hmm.
In terms of finding specific providers, I think it's very dependent on, your area and where you live, and what resources you have available. So at my institution, like, we do have an integrative medicine group where if patients are interested, I can refer them for a consult. Our acupuncture group is undergoing, there's somebody who's retiring. I don't know if there's like somebody who's good to refer to right now. So there are even those like individual, changes that can make a difference as to who I'm able to recommend from my position.
Yeah. No, that's really good points about, how to manage results. And you talked a little bit about, you kind of touched upon that communication, which with other providers, we're going to get into the next section, but I'm going to turn to Dr. Parikh. Dr. Parikh, any red or green flags, tips that you can share in vetting appropriate integrative specialists?
So when it comes to a provider, picking any provider, I usually recommend asking 3 questions. First is, are you open to communicating with the rest of my team, right? People who have the best interests in mind, they'll be open to communicating, collaborating. Number 2, how do we know that the treatment you're recommending is safe? So ask that question to your providers to say, what is the research? How do I know this is not going to hurt my liver? How do I know that I'm not going to have all these, what are the side effects? So inform me. How do I know if this is safe? And the third thing, how do I know that this is effective? Right? How are we going to know, is this really helping me? Is it just by me saying, oh, maybe I feel good today or not? Or are we going to actually track my inflammatory markers, my calprotectin? Or how are we going to know if this is working? Because if you don't ask these questions, you end up spending a lot of money, a lot of time taking bags full of supplements without knowing if it's really helping you. And often it could be hurting you and you might not know it, right? So when you're picking a provider, ask, are they open to communicating, collaborating? Ask them, is this safe? How do you know that? And is this effective? How are we going to know that? So if you do that, then I feel like you can weed out a lot of those red flags, because people are just trying to turn a quick buck, sell you supplements, sell you some magical diet. They're not going to be able to answer yes. So
Yeah. And I think Chiti maybe froze for a second. There you go, back. I was going to say, I love what you just said there, because if it was a, prescription medicine, right? We would ask our provider, well, okay, how long am I going to be on this for? What are my metrics? How long should I start to feel better? A biologic. Do I submit my calprotectins on time? Do I get scoped? It takes 3 months, 4 months. These are the same things you should be asking the provider about the whatever the regimen that they might be providing. I love that. So let's say they ask those questions. Are there any other things that you would be on the lookout for before I move on? Any other red herrings that you might be concerned about?
One thing that I would mention, probably piggybacking off of what Dr. Parikh just mentioned, is that I almost think the number of supplements you walk away from in an appointment is inverse to the benefit that you're getting. So if you walk out of a consultation and you have an idea about maybe some lifestyle changes, like one or two like supplements or medications that you could try to see if they help, I think that is sort of a reasonable, outcome of a visit with a practitioner. If you walk out of an appointment, having put down a down deposit of, $300 for something and 20 different supplements, that is probably a situation where I would not expect it to be as effective, to be honest. And I do have patients who come into my clinic visits with literally laundry baskets of supplements that they have been given by a single practitioner. And in those situations, I do tell patients, I think you may need to do essentially a detox, like a cleanse of the supplements that you've been given, because it becomes too confusing, it's too cloudy. We don't know what's interacting with what.
Yeah. And then, so a couple of things we've talked about so far have been, how to find and vet an integrative specialist, look for licensure, look for reviews. And when you meet with them, ask solid questions, very concrete questions. And you can have these written down in advance. So when you go in person, you don't forget to ask, right? How long am I going to be on these supplements? What's the time frame till I feel better? What's the backup plan? Also, we talked about building and your integrative, your interdisciplinary specialists. And there's a couple of other places that you can look for such disciplinary as the Rome Foundation has gastro-psych and complementary medicine specialists. They have a registry for dietitians as well. So does the American Academy of Nutritionists and Dietetics. If you go to eatrightpro.org, they also have licensed dietitians there too. So look for these credentialing databases that are online. If you don't know, ask your provider, hey, where can I vet these providers? We've thrown a word around a lot. I'm gonna say it out loud again. We've thrown this word out. I don't know what it means. And I do, but I don't. Supplements. What are supplements? I mean, that's like a really broad term, right? What are supplements, Dr. Parikh?
So, and I really want everyone to pay attention to what I'm about to say, because supplements are exactly that. They're supplemental. They're not a treatment or a cure in itself. Unfortunately, nowadays, what gets most noticed is something I can sell, right? So for social media, it's a marketplace. So I cannot sell, good habits, mindful eating, and all of this, but I can sell you supplements very easily. It's a product, it's a commodity. Just so you know, so in the US, even with all the rules and regulations you have, if I was to do research and come up with a medication, I have to go through years and years of vetting to be FDA approved. Supplements. Today, I can buy empty capsules on Amazon, put in salt or sugar in a capsule, package it beautifully, and call it Dr. Parikh's Magical IBD Cure and sell it, and there is nothing stopping me from doing that. Again, I can do that right now in the US and sell it, nothing stopping me from doing that. So this is the reason why you have to be very careful when you think about supplements and rely on them. You definitely need to keep your eyes and ears open, whether, because you're putting these things in your body, right? Like it's going in your body. If you're taking bags full of supplements, these supplements still have to be digested, metabolized, processed by your liver, by your kidney. It is taxing your kidneys, your liver. So the more work you give these organs, remember, they also have to process your medications. They also have to address, the food you're eating. They also have to take care of the underlying condition you're dealing with. So supplements are just that. So when it comes to the world of integrative medicine, I often tell my patients is that diet, lifestyle, mental attitude, your mindset, those things are 32% each. And supplements are less than 5%. Okay. So focus on the 90+%. Don't spend your paycheck on some random supplements some influencers trying to get you to buy. So really focus on the big picture. And I really want to emphasize that because there are people here from all from different backgrounds, from different parts of the world. They might not have access to the latest and greatest supplement that's trending on TikTok. They might not have access to a lot of those resources. But I will tell you right now, after years of practicing this way, the best thing, the most effective things we're going to talk about today are free, and everyone can do them. It's not going to cost you a penny. So that's why let's bring this conversation to the 90% that we know science has proven to be safe and effective, rather than chasing and spending so much money and resources on a few percent that has much greater potential to even harm you. So I hope that helps.
100%. No, that helps a lot. And both you and Dr. Luke kind of pointed to that there is a secondary gain, a financial gain that people have in selling supplements or marketing supplements. And that can happen online, on social media. It can happen even in the practices themselves. And so you have to be mindful. There's billions and billions of dollars that are made on these supplements. And like you said, they could be a sugar or salt pill in some cases and really not have anything. So if you do a supplement, look for the evidence. Companies do third-party testing on everything. If they publish third-party testing to validate that, yes, this supplement actually has what it says it does. Again, another company does the testing and they publish those results on their site, that can be a little more trustworthy. Then look for the evidence. Is it effective? And then be mindful of drug-drug interactions. There's also too much of something can be a bad thing. And vitamin A toxicity can give you liver failure if you take too much vitamin A, for instance. So always consult your personal physician who's monitoring you. Let them know, let them be aware. I want to move next forward to, communication, right? This is the barrier that prevents so many things in medicine from happening well. It prevents patients from being well informed, right? It prevents clinicians from sometimes working together. And sometimes clinicians, we can always, communicate and listen more to our patients. When it comes to this topic of integrative health, I'm curious, what are some tips on how to communicate better with these integrative specialists? How does it work from the physician? And Dr. Liu, what kind of practices might you encourage to help communication between integrative specialists and other physicians?
From my perspective, it may depend a lot upon physician style. But one thing I always encourage patients to do is to bring paper records with them. It's very convenient to have things in the electronic health record. However, if you're going to an appointment and you're not sure if your provider has access to your other team members' records, it's okay to bring paper. From my perspective, we do sometimes get intimidated when there's, like a textbook 2 inches thick of records, but I'm always happy to review like the latest progress note from your other doctor to get a sense of what their thoughts were and what their treatment recommendations were. I would say too that I think an integrative practitioner should be open to reviewing, an allopathic doctor's notes, or to reviewing my notes, for example, to see what the medical treatment plan is. I personally will give my work email address to other practitioners so that they can contact me directly about specific cases. I think that is something that is more a matter of style. Sometimes the burden of communication is put on patients to say, could you ask your other doctor for me this question? And that can be unfair to patients. That's why I try to provide my own contact information. But at the same time, there are some situations where there are some offices that are, either so remote that are not, connected electronically to any other system where that may become necessary. So maybe just understanding that and knowing that that's why you're being asked to do that, would be good for you to know. I think that when it comes to communication, it's good to approach it, for any practitioner to approach it from the standpoint of what are our shared goals for this patient? What are the ways in which we're treating this patient? What process are we trying to address? I think that's what I'm usually trying to figure out when I'm communicating with somebody from another discipline. And if we can find a shared process that we're trying to work on together, maybe just with slightly different treatment approaches, we can definitely find ways to do that. It's really more so when communicating with other practitioners, if we are not, working on a shared process, like a shared biological process, then I think we may not be able to work together. But that should be a discussion between practitioners.
Yeah, I think that, sharing your contact information is really helpful, and encourages that dialogue so we can talk. In fact, the red herring would be that if they don't want to communicate back, that's a red herring, right? If they don't want to pick up the phone or write an email. I'm glad you said, you kind of read my mind as to what I was hoping you would kind of touch upon, Dr. Liu. I want to talk to Tina and Gaurav now. Sometimes, traditional Western doctors, not sometimes, oftentimes, let's just be truthful, right, may look down or not take other specialists seriously, which I think is a disadvantage to the patient, right? And how far everybody's discipline has come. And that can, make it challenging for patients to have their providers communicate. As Joy said, we don't want the patient to be in the middle, right? It's the providers that should be talking. Tina, Gaurav, what has that experience been like? How did you get your clinicians to speak? Was that challenging? Was it easy?
I'm happy to start. It was extremely challenging, Dr. Nandi, and no shade on the medical system whatsoever. I realize physicians are extremely, extremely busy, and that you have hundreds, if not a few thousand patients. So it can be very difficult. I think what's helped, and I recognize that this is not something that's available in many other countries, especially in the global South, is like an EMR system that's putting together all the notes. So now I'll have, my liver doctor from one institution put in there, I need 20 different labs, and then I'll have integrative nutrition put in, I need a couple of these labs, and then eventually I'll have one of my doctors sort of order it, usually my PCP. That's how I've been doing things to help streamline communication. But I agree with you. Sometimes I do have to ask for my doctor's email address to give to another doctor, such that they can communicate about, especially when it comes to like supplements and other medications. For instance, I was just changed for a medication that I'm on for another condition, a urinary condition, interstitial cystitis. Because I have so many different conditions, I have to check with 4 or 5 different doctors if it's okay for me to switch just that one medication. So when it comes to complementary therapies, it can be even more challenging. Like Dr. Joy said, is, a lot of these folks that might be doing functional medicine will not be on an EMR, and of course, understandably so. So it's really important, and I want to make sure I emphasize this and have our patients listen closely too, is, I know it's really hard to ask your physician, look, I'm taking turmeric or I'm taking whatever other supplement. How is this going to interact? And or is this even safe for me to take? Guys, even as something as simple as turmeric enemas can lead to damage, especially with rectal disease. You have to be really careful what you're doing. Just because it's labeled all natural does not mean, you're not going to hurt yourself or harm things further. Please make sure you're talking to your doctors. I hate that the burden often has to be on us as patients, but we have to take care of ourselves. And if we're going to these lengths to make sure that we can get better, we need to ensure that the product is safe for our use and doesn't interact with other meds. Look, I take turmeric, gummies as suggested by my integrative physician from time to time, but I try not to overdo any kind of supplements. Trying to make sure you don't overdo the number of supplements and overdo, what supplements you're taking is really, really important too.
Yeah, no, absolutely. Those are really good tips. And and you kind of relayed how challenging it was to get your providers to communicate together. Gaurav, what was your experience like? You mentioned you were with Ayurvedic practitioners, homeopathic practitioners, and you have your traditionally trained physicians. What was that like?
So I've got a very straight up and honest rule, and it's worked very well and beautifully for me, which is I'm not going to put anything into my mouth till I consult my GI. And I make that very, very clear with everybody that I'm seeing, including alternate practitioners. What's wonderful about my relationship with my GI is that it's absolutely great, right? I have been lucky enough to have a supportive GI who I've built a wonderful relationship with, where I can actually reach out to him and ask him about anything under the sun, right? And he is very, very candid and honest about his opinions, in the sense that if he doesn't know anything about it, he's going to be like, look, Gaurav, I've never really heard of this working, and or anybody taking it, but doesn't sound too harmful to me. If it helps, then go ahead. Or he'll be like, look, I've had a few bad experiences here where some of my patients have done this and it's kind of backfired, right? And I think that honest conversation, something that we were talking about earlier, is very important, and it's worked wonderfully for me. And there have been times when he's absolutely warned me against taking something, going like, look, you've got an autoimmune condition, and this kind of can backfire by really enhancing your immunity, which may sort of cause a flare up, right? In Ayurveda, he's warned me against certain medicines and medications and certain herbs which he thought wasn't a good idea.
Yeah.
So it's been wonderful that way. I think it's very important to have a very good relationship. By the grace of God, I do, with my physician, and that has helped in the long run. So I consult him for everything, even before doing homeopathy. He doesn't really think very highly of it, to be honest, but I still tell him that, okay, this is something that's helped with my IBS. Do you think it's going to have any side effects? And he sort of does his little bit of studies, and he says, look, I've asked around, it doesn't seem very harmful. You can go ahead if it's helping you, but why don't you try this instead? And he'll give me maybe another tip. So that's how I sort of handle the situation.
Yeah. I'm listening to both you and Tina speak as, very educated, empowered, proactive patients, right? You're not your average patient, in my opinion. You're obviously in this space. So let me ask you a question, and I want the providers to chime into this too, and all those of you listening at home. Why are people looking for complementary therapies? They have their Western doctor and they have treatments, etc. But what's the why? Gaurav, Tina, why are you looking? I can guess. Why are you looking for a complementary therapy?
I'm happy to go first.
Go for it. Go for it.
So, in my opinion, I'm going to put this into my own perspective, Dr. Nandi, and talk about when I was first diagnosed with IBD. Let's begin with that. More than anything else, I think if I go back to 2015 when I was diagnosed, and when I was told that this is a lifelong condition, and it's not something that has any particular cure where you're going to get completely all right. It's going to be management, but it's a chronic issue. It's very overwhelming and difficult for anybody to accept that. I think for me, the reason why I have to admit, at one point of time, I let go of the medication and I tried alternate therapies that sort of backfired very badly when it comes to my IBD. And, the reason I did it was I just wasn't ready to accept the fact that I had a chronic condition. And I think a lot of patients go through this, right? The other problem is not just you, it's the people around you, especially your family, who find it very difficult to accept that their child or their nephew or somebody who they love so much is stuck with a disease that they can't do anything about except manage it. It's not the easiest of things to come to terms with emotionally. That's probably alternate therapy started for me in IBD as hope for a cure. But with time, I realized that this disease is extremely complicated. And there are millions and millions of dollars, I'm sure, that are being spent in research every day to find, leave alone a cure, the cause of the disease, which is still unclear, probably, right? And you can't just rely on medication or a medical practice that is based out of 1,000 years ago, when they probably didn't even know what IBD was, or a homeopathy, which is supposed to be technically symptomatic treatment, right? It's not supposed to be treating from the roots.
Yeah.
So I realized that, physical medicine or modern medicine is extremely important to keep your disease in control, and that's something I stand by today. But if for me, certain alternate medications just help me feel better when I'm having a bad day and I need to show up at work, which is important for an entrepreneur like myself. And I've just got a bad day, and I just use it to sort of muscle through, and that's my only use for it.
Yeah. No, yeah, I mean, I love how you put that, yeah, just to put it in perspective, our community, IBD patients, other gut health illnesses, any chronic illness. I mean, the hardest thing is accepting this disease. And you're right. In 2026, we don't have a cure for IBD, and stay tuned. I'm optimistic about the future. But for now, it's hard to accept, how did I get this illness? Like, what did I do, right? And the truth is, you did nothing, right? This happens to the best of people, right? Bad things happen to very good people like you all, right? But it's hard to accept that. There's also something that Dr. Taft brought up, in the comments, one of our board members and gut dedicated psychologists, about the mistrust in the system, in medicines. And Dr. Liu, I know you wanted to talk about that too. Did you have a comment about that?
Yeah, I was just going to bring up that I think one of the reasons that I know people look elsewhere is because our current treatment plans are often not 100% complete. And there's a lot of complexity that goes into that. What are the patient's expectations for feeling normal? Like what kind of goal are we looking to achieve? But then also, like, what treatments can we provide? And a lot of them do fall short, or there are a lot of side effects, or there are a lot of logistical challenges, like having to fight with your insurance about getting a medication that your doctor recommended. However, there are errors in the medical system. Medicine is still a human practice. And so sometimes there are errors that patients experience, like a doctor who makes a recommendation that was not appropriate for a particular individual. Sometimes there are complications of procedures that, we don't walk into those procedures expecting any complications, but sometimes they happen. And then sometimes, historically, there have been certain unethical practices in Western medicine that, just we're aware of, where people were either given some kind of treatment without their consent, or maybe whether a certain group of people was discriminated against. And that all has echoes for how people interact with the medical system these days. And, I think we just have to recognize that. So I think, kind of going back to one of Dr. Parikh's first points, she mentioned that she learns a lot from her patients, and I would say that I do too. And I think it has to be kind of like a mutually beneficial relationship in that way, that we hopefully provide appropriate treatments to patients, and that they also teach us something about what they're experiencing. For example, like, I will take, recommendations for other subspecialists from my patients, because I'm interested in knowing, like, who they've seen, who they found helpful, who they felt like they could trust. Because if they felt like that was somebody they could trust, then that makes me more confident in that person too, to hopefully help the next patient.
Yeah, no, that's really important. Mistrust of the system, many precedents of things that should never have happened, that medicine is trying to learn from and make amends for. Yet that distrust persists. It's depending on culture, depending on country. It's also generational. So many things there. Tina, I know you've had some experience and some thoughts on this. Did you want to share some comments?
Absolutely. So I 100% agree with Gaurav. Of course, family pressure, difficulty in accepting the chronicity of an illness, especially when you're in your early 20s. It's the rest of your life. So I remember my family saying, how are you going on that biologic? Why do you need medication for chronic constipation? Why do you need antibiotics for such a long period of time? These are going to give you so many side effects and you're so young. There's a lot of that playing in our minds, I think. And also to Dr. Joy's point about some of the medications, having potentially, 30 to 40% efficacy rates. It's not enough for us patients. So we're trying to supplement in order to make up for that difference and find a way to regain quality of life. There's a lot, at play here. But something I wanted to highlight, and Dr. Nandi, I think you know all about this, is from our from SAIA and AGA's Clinical Research Roundtable last year at Digestive Disease Week in San Diego. We had patients, 10 or 11 patients from all over Asia, Asian American as well, and Pacific Islander as well. And I think one of the things that really came up is that historical and intergenerational trauma. I know I myself and a couple of other patients shared this, is just my family experienced so much trauma from the 1947 partition of India and Pakistan that we lost our homes and our businesses in Karachi had to move to India. There's no way we trust Western medicine. And this might not be a popular statement, but that is very much 100% the truth, at least in my family. So it is something to point out that mistrust is an issue across many, many communities, whether that's Asia, whether it's the Black African American community, whether it's Middle East, North Africa. It's very hard to trust a system when our families have been massacred, by certain colonial times. And I will just say that and put that out there. And it causes us to look for something else. At least that was the case for me and my family.
And I think, that theme of, conquest, colonialism, I mean, in different cultures have experienced that, and that continues to paint or influence decision-making. We've covered a lot of interesting facets, right? We began by talking about what is integrative medicine, what does it encompass? We had a nice discussion about how to find the right providers, the right specialists, how to vet them. What are supplements? Dr. Parikh gave us an idea about supplements. But something that was really impressed on me with what she was saying was that there's a very small percentage where supplements fit into your holistic care plan, right? You mentioned, Titi, that there's other many major aspects and factors like sleep quality, nutrition, fitness activity, stress and symptom management, right? That a provider can really help you work on. Dr. Taft actually mentioned in the comments that sometimes what patients are looking forward to is someone listening to them, right? And sometimes the traditional clinic provider may not have enough time, right? But integrative specialists are really good at communicating, giving that time. I was hoping you could take us in these last 10 minutes of our hour into talking about what are some daily things, practical things that patients might be able to incorporate that might fit those pillars of management. And Dr. Liu, I'd like you to chime in too if you have some tips for us as well, please.
So when I talk to my patients, I often joked when I do webinars or podcasts that I'm the kind of doctor who does not care about your diet. I don't care if you go to the gym. I don't care if you're stressed. And people are always like, oh my God, you're integrative medicine. How can you say that? Because I think our attention is focused on the wrong things. The first thing I focus on with my patients is something called chronobiology. So this is sort of all the buzz in medicine, right? Our circadian rhythm is literally the foundation upon which everything else is built. So when I talk to my patients, I don't often ask them what they eat, what their diet is. The first thing I ask them is, walk me through your typical day. When do you wake up? When do you eat? When do you exercise? Tell me, what does your day look like? And when someone says, Well, it varies. Then that's my first opportunity. I'm not going to talk about the diet, anti-inflammatory diet, supplements, none of that until we have a routine. So that's your circadian rhythm, that's your chronobiology. And I'm going to use a very corny analogy to drive this point home. So, and I love doing that because you're not going to remember any of our faces, you're not going to remember anything we talked about, but people often remember corny stories, right? So I hope you remember this. So I'm in New York here. It's World Cup time. So imagine everyone attending this session today, everyone gets a free all expenses paid trip to New York for 4 days. And we're going to pay for your flights. We're going to pay for you to go to World Cup. We're going to pay for you to go to all top restaurants in New York. Right? But the only condition is you cannot have your phone, your watch. You're not going to know what time it is, and you cannot ask anybody what time it is. Okay? So now imagine having to get on a flight, attend a match, reservations. You have to do all these things, but you have no idea what time it is. How is it going to work for you? It's not. It's going to be utter chaos, right? Yeah. That's exactly what happens to your body. You can have the perfect diet, all the supplements, everything. But if you do not have a routine, if your body cannot follow a clock, it will not work as effectively, especially for IBD patients. This is utmost important because your gut has the most primitive clock. Your gut motility, your digestion, your healing, repair in the gut is all tied to genes that are activated at a certain time of the day and the night. So I don't care if you have a perfect diet, but if you're eating your dinner at 8, if you're eating your dinner at 10 p.m., if you're into skipping meals, you're grazing all day, even if you're getting 8 hours of sleep, but you go to bed late, irregular bedtime. Yes, you go to the gym, but then you're just sitting in front of a computer for 8 hours. Like, that's not going to give you what you're looking for, because this idea that we have that, hey, I got to drink my green juice, I got to go to my gym, like I got to do this, and that means I'm healthy. It is the wrong picture that's been painted in front of us. Okay. First thing, if you take one thing away from today, is routine. Be boring. Respect your sleep time. If you want to respect something about yourself, respect your routine, like your life depends on it, because it does. Do not sacrifice your routine for anything else, right? If you can't eat a perfect diet, I don't care. If you cannot get 8 hours of sleep, I don't care. You need to go to bed at similar times, same time as much as possible, eat at the same times. Once you do that, then only I talk to my patients about what to eat, right? Like, so the timing of all of this matters far more, and it is free. We can all do that. In this busy lifestyle, we always say, I don't have time for this. This is make time to be boring and predictable. Because remember, if you want to enjoy that World Cup match, that free trip, one thing, simple thing like not having a clock will ruin all of it, right? Same thing goes for your body. And in Ayurveda, in Chinese medicine, Ayurveda, the first fundamental thing in treatment that we focus on is something called dinacharya, daily routine. There's no fancy herbs. There's nothing that is prescribed to you until you have a daily routine. So remember that. And even if you think about Western medicine, nowadays in oncology, we're actually timing the dosing of different chemotherapy drugs based on circadian rhythm. So we're saying, hey, this chemotherapy drug actually works better when given early in the morning. Hey, this drug actually works better when we give it later at night, synchronized to your circadian rhythm. So respect your body, respect your clock, respect your time and your routine. That's going to go further than any diet, any supplement that you're going to buy. So I hope that helps.
Oh, totally. No. I think it's the biggest, one of the biggest pearls we'll take away from this conversation, right? And it makes sense, right? The more you control, then if you're trying to figure out, well, is it because I'm eating this or eating that, or I'm not drinking enough, or I'm not working out? If the more regimented, the more disciplined, the more routine and predictable you are, the easier it is to figure out what are the changes that are going to help you potentially, right?
Yeah. And one last thing I'll say is that this is important to bring up, because your body is one of the most intelligent creations ever, right? Your body is so extremely capable of fixing things. When we are sick, we often blame the body. Oh, this is broken, that is broken. But we often forget that there's so much that our body can do to help us heal. We often just get in the way, right? So when I'm talking about first things to do, your routine is just getting out of the way. making it easier for our body to do what it's supposed to do. And it's not going to be a herb, it's not going to be a supplement. It's literally giving it some predictability, a routine. So you can say, okay, during the day I'm digesting food. At night I'm healing, I'm repairing, I'm going into a fasting state, right? So all of this is pre-programmed. We don't have to do anything but just support it. So I hope people come up with this idea that, okay, our body is capable of a lot more than just being broken, right? It can heal itself too. We just have to support it. And we do it by allowing it to do its thing. It's not just external things that I'm going to buy that's going to support it. So.
Totally agree. No, this is fantastic. Anybody else has got any thoughts? I was really curious, Tina, Gaurav, how does that resound when you guys hear that, right? Developing a routine. And are there other things that you have learned that are helpful for your own individual care that you've integrated that maybe others can learn from, that's helped you?
Gaurav, go ahead.
All right. Okay. Thank you, Tina. All I can say is if I was ever to consult Dr. Parikh, she would absolutely consider me the worst patient that she could come across. Because my routine as an entrepreneur, as a founder, is absolutely erratic and totally not in sync. I do try my best, though. I honestly do. There are certain habits that I have inculcated. For example, I realized that sitting with the computer and my phone at night was delaying things far more and delaying my sleep time far more. So I have realized that post a certain time, I just drop my phone and I drop my screen. And that has helped. I've managed to pull back my sleep time by a couple of hours, unless there's like a deadline to meet and there's nothing I can do about it. But I do try to do that. Yes, I think whenever I am in routine, I absolutely do realize that my body is functioning way better than when I'm not. And this is something that I can tell you firsthand. But apart from that, I try to do my little bit. For me, exercise has always been a very integral part of my life, and I've always been into very high intensity exercising. Back in school and college, I used to be a part of the dance troupe, and we used to hip hop and b-boy and stuff like that. Then I moved on to a lot of mixed martial arts training, which was very, very intense, and this was after my diagnosis. But over a period of time, I've realized that the body needs a certain different kind of exercise as well. Like I'm concentrating a lot more on mobility now, yoga, things that keep my stamina up with whatever little time I get. And I guess I've just changed my routine according to what my body needs more than what I really wanted to do. And these are some of the things. When it comes to my diet, even if I'm eating out, I try to be conscious about what I'm eating, rather than there are times when I have to be, I have a social obligation like a meeting, and I can't just say I've eaten at home and come. It just looks rude. So I have to just pick and choose from the diet and select something that's according to my IBD and my condition, that doesn't give me a sort of discomfort. And these are some of the things that I try to do on a daily basis. I could do a lot better, admittedly, and the efforts are still on, and they shall be. But that's pretty much it.
Well, it sounds like you've invested a lot of time into something you really enjoy, which is physical fitness, right? Which has been shown to, not only increase endorphins, but also anti-inflammatory cytokines too. So, that's something that you've done proactively to find something that works for you. Tina, what's worked for you?
For me, it's a work in progress, very similar to Gaurav, but I would say pretty regimented about meal times, just given the gastroparesis, and about medication times, also given how severe the chronic constipation can be. So I do follow a pretty good regimen. I think sleep is one of the things I need to work on more, although I feel like that's gotten better over time. I do also feel like stress and stress is one of the things that I've been working on. I would say meditation helps a lot with that, and deep breathing. And I think there's a lot of things, like Dr. Parikh has been saying, that are free, that we can do to keep ourselves, well balanced and grounded in a lot of different ways. But I do also agree with what Dr. Taft wrote in the comments, is that hustle culture is real, and the stress and the travel and the diet, they can be very hard in today's world. Another thing that I do is just make sure that if I'm traveling, I'm carrying clean snacks for me to have, such that if I don't find food that I can eat, I have something on me at all times. So I am as regimented as I can be, but I also feel like there's work to do. But again, I want to emphasize the importance of self-love and not judging ourselves too hard or being too hard on ourselves. We're doing the best we can. And, having to manage these illnesses is hard enough. So also make sure we're giving ourselves that love.
Yeah, and I think, giving that self-love and giving yourself grace to make mistakes, right? It's hard to develop a routine, a regimen, but I think something to take it when you step back. Again, when we're going through a flare, I mean, it's worst time ever, but one of the best times to develop this routine in flare is when you're well. So sometimes I see patients who've done what it takes to get through the flare, whatever they can possibly do, but once they get well, they might fall into some unhealthy practices of diet and fitness in particular. But that's the best time to invest in yourself, right? To develop when you're feeling better. And again, nutrition, stress management, sleep quality, not perfect for everyone, hard to manage, but something still that you can work with a specialist, because it's in your sphere to maybe develop a routine, something you can control. Try to control what you can. Dr. Liu, any comments or reflections on this conversation as you lead us off, as we start to wind down this conversation? I'm going to go and ask for one or two pearls from everyone as we wind down, but Dr. Liu, anything you wanted to add to this conversation?
Yeah. The analogy that came to mind as everybody was talking was, when we learn about a part of the nervous system called the autonomic nervous system, which helps to control GI function, we learn about the sympathetic nervous system, which is your fight or flight response, your really activated response, versus the parasympathetic response, which we say is rest and digest. And we know that for the GI system, that parasympathetic rest and digest input is really important. So I think just emphasizing what everybody has said, establishing that routine, getting truly restorative rest, doing things that promote even keeledness, as opposed to putting your body through roller coasters of stimulation, is really helpful. As one of my patients who had pretty refractory IBS told me, she said, wow, it turns out that if I follow a diet, I go to sleep at the same time every night, and I learn what my stress triggers are, it turns out my IBS got better. Imagine that. And I wish it were that easy for everybody, but it's just to say that sometimes when you do establish that routine, it really can be very helpful for your health. And you don't have to take a medication to address your symptoms then, which is great. The other thing I would say is that there are a lot of different tools out there for figuring out how to build that routine. So gathering data, whether you use an app, whether you use pen and paper, start to write down some of symptoms and how that correlates with, whether you traveled, what kind of food you had. We don't want people to feel like they have to write down every single thing or weigh how much food they're eating. But if you can get some data, you can look back at it a couple weeks later and say, oh, maybe here are some places where I could improve. Here are some things that I'm doing well. Good job to me. And that's also data that you can bring to your medical team.
Very practical points. I love that. Thank you so much, Joy. I'm going to go with Tina, Gaurav, and then Dr. Parikh. Tina, any closing comments?
I would just say this has been a much needed talk from a SAIA perspective and from a patient perspective. I just appreciate folks tuning in and being so open-minded. This is not an easy conversation to have. And often, like I mentioned earlier, it can be stigmatized to bring up to our doctors or to bring up to our families or to even deal with the family pressures. I just want to say you all are doing great. This is not easy navigating chronic illnesses. Instead of blaming, shaming, just remember to show ourselves the love that we deserve to.
Absolutely. Beautiful. Gaurav?
Uh, yeah, I would agree with Tina. I think I'm just so happy that I could be a part of this wonderful discussion, and there's so much to learn, and I've learned so much. I think very, very important points that Dr. Parikh and Dr. Lu have mentioned about, being in the restful state and having a routine. I'm just taking away a lot from this. I'm going to try my level best to follow as much as I can, given my limitations. And, the entire idea of consulting your GI, but having certain integrative practices that are basic and simple is also important rather than going for the complicated things such as supplements. So it's been a great conversation, and thank you so much for having me.
It's been our pleasure and our honor, Gaurav. Dr. Parikh, please close us out.
Yeah, thank you so much. I emphasize consistency or perfection all the time. And also nowadays we are led to believe perfection is, perfect diet, doing all of these things down to like what looks like what you see on Instagram, but that's not the reality. So I want to set that expectation is the routine, the consistency gives you that foundation. When things don't go your way, you can come back to your balanced state much faster, right? So it's just the work you put in 80% of the time that's going to give you that reward 20% of times when you don't have all that support. And last but not least, I do strongly believe your mental state is going to be the most important thing over any diet or anything you supplement, right? So that's why what Tina mentioned is love is the best medicine, and it starts with self. So respecting self-love, appreciating what our body can do for us, and then having this amazing community. And kudos to all of you who created this forum, this community, to help everyone navigate this very challenging condition. So the best medicine is right here, is all of you supporting each other. I think that's going to be the key in success for all of us. So thank you for all the work you guys have done in putting this together. And thank you for all of you for showing up. And your presence in itself is the therapy that some of us needed. So thank you for being part of this.
Thank you very much, Chiti. Really appreciate that. To our audience, thank you so much for your enthusiastic comments and listening to this conversation. We've done some other talks like on specific types of complementary therapy, so you can check those out. Those are on Enduring Learning on our webinars on Facebook. This was really a discussion on how to find a good integrative specialist, what to look for, red flags, green flags, how to promote communication and engender interdisciplinary collaboration, and also really understanding that there is a role for supplements, but it's individualized, and that perhaps the majority of your care really focuses on some pillars of management, looking at sleep quality, nutrition and fitness, stress and symptom management. Clear collaboration with your primary medical providers is critical and key to making sure that whatever is prescribed or recommended is safe and going to work for you. I hope you learned a lot from this conversation. I know I did. Develop routine. I want to thank each and every one of our guests, Dr. Joy Liu, Dr. Chiti Parikh, Tina Aswani-Omprakash, and Gaurav Sengupta, and our entire SAIA team who is helping to conduct and orchestrate this webinar behind the scenes. You can learn more at saia-gi.org. You can also go to our Facebook page, Instagram, and even join IBD Desi's, our community forum that's privately moderated on Facebook. Thank you all for spending your Saturday with us today. And in case I don't see you later, good morning, good afternoon, and good night.